Hi, good afternoon, everyone. Welcome to today's health talk. And now the timing is 2 o'clock, so we will start in 5 minutes while waiting for the rest to come in. Hope everyone have your lunch ready. Okay, we'll start today's presentations. Okay, I think more or less everyone is present already. So today's health talk is on eye care series 2. I guess everyone have attended, most of you or all of you have actually attended the series 1. And so series 2 is actually on some facts and some tips on eye care, especially for elderlies. So my name is Vincent, and together with my colleague, Singni, will be the presenters for today. All right, so basically these are the scope of the presentation for today. So we will talk a little bit on eye screening, what are some of the eye screening that is conducted. So we will also share with everyone what is done during an eye examination, what you will go through and what to expect during an eye examination. I'll also be sharing with everyone on some of the tips and tricks to take care of your eyes. And last but not least, we would like to share with everyone and to debunk some of the myths that we have about eye care. All right. So I guess many of us have this question, like, to think about which age will we go for the eye examination. So these are some of the questions that we may ask ourselves, like, sometimes we may think that, okay, I'm just 50 years old, or maybe I'm still very young. My eyesight is perfectly fine. Do I really need to go and see a doctor? Do I really need to go for a checkup? Or some of us may be thinking, oh, I already have so many appointments with the doctors already. Then some are seeing for my heart condition, my kidney lah. Then all the doctors already follow up, so I don't need to see the eye. So, but there might be some questions on this. Or maybe some of us may think that, okay, yeah, we use the eye drops, then maybe my spouse is using the eye drop, it's also suitable for me. So if I Google about the eye drops, then I should be able to use the eye drops. And some of us may think that, okay, at this juncture, I don't need to wear a spectacle, so I don't really need to see a doctor. So these are some of the questions that surrounds us every now and then, like when should we seek for help? So in this sharing, in this health talk, we'll be sharing with everyone on when and where is required for the eye screening to be done. Yeah. So first and foremost, for eye screening, the most important thing for eye screening is these two main factors. First, we must understand that if a person has a risk factor, what are some of the risk factors that they have? Pre-existing risk factors can be your chronic disease, such as diabetes, hypertension, or hyperlipidemia. So these are some of the chronic silent killers or the chronic diseases that increases the risk of developing eye disorders. And adults aged 40 to 64, at this juncture, this age itself predisposes a higher risk of developing eye conditions, because as we age, our eyes also deteriorates over time, and this results in us developing eye issues. And although sometimes it may not exhibit signs and symptoms, to detect the conditions early and to treat it early, it can reduce the complications and reduce the risk of being blind at a later stage in life. Yeah. So many a times there will be a lot of questions. There's some thoughts by all of us thinking like, okay, what is expected during an eye examination? So sometimes maybe like we are thinking, oh, maybe just seeing the eye doctor is just getting a pair of glasses. It's actually more than just that. So actually, the ophthalmologist, who is the eye doctor, who will be able to inspect your eyes, to check your eyes, as well as to ensure that your eyes are perfectly fine, to be able to see, to be able to see far or see near in terms of making sure that your distance is corrected and make sure that everything is fine. There is no any issues with your eyes or any problems with your eyes. Yeah. So what they will do is they will do a series of examinations, and the eye examinations normally don't hurt. So the basic examination includes an external check of your eyes. Like for example, they will take a look at the surrounding eyes. Your eyes includes your eyelid, your eyelash, and your surrounding areas are parts of the eye like the conjunctiva, the sclera, which is the white part of the eye, the cornea and the iris, as well as the pupils. They will shine some light to see how is the movement, to also do ophthalmoscope to actually take a look at the blood vessels to make sure everything is okay. So like for example, like what I've actually reiterated earlier on, if any of y'all is having chronic conditions such as diabetes, which increases the risk of developing complications with related to the eye, therefore it's important to routinely go back for eye examination every year. All right, so from this examination, they will be able to inspect for any signs of disease. Like other than just only looking at your vision, they also can inspect and to see whether there's any issues with related to your eye. Yeah. Okay, so some of the tests includes testing vision, which I believe most of us have went through this. Okay, testing of vision where the nurse we will sit at a certain distance. Yeah, to actually ask you to read the alphabet or read the numbers from the biggest to the smallest, or from the smallest actually to the biggest. So is with or without the corrective eyewear. So sometimes you may be wearing glasses, they will tell you put on your glasses and read the numbers or read the alphabets. So if the degree is not corrected, you may have certain issues with understanding or seeing the numbers or the alphabets itself. And at the same time, they also will shine some light to actually see how is the pupillary movement. The pupils is actually the dark part, the black part of the eye, to see whether there's any movement. How is the movement like? So when there's light going in, the pupils will close. And when there's no light, the pupils will open, so to allow more light to come in. So that is to check for the eye muscles, as well as most importantly, to actually look for peripheral sight visions. Yeah, to look at the sight. Sometimes there might be certain issues that maybe a person can see what's ahead of them, but the sight vision may be a little bit impaired in a way that there might be some blurring or some darkening of vision or some blackout on the sight. So they would like to find out how is your peripheral vision, because our vision also helps us to determine whether the distance, or it can help us to prevent ourselves from injuring ourselves, like a fall, help us to determine the distance, the depth. Yeah. And also at the same time, like what I mentioned, to use a ophthalmoscope to actually look through the eye to see how is the blood vessels, is there any issues with the blood vessels, to ensure that the blood vessels are okay. Like for example, in series 1, I guess my colleagues have shared with everyone with regards to glaucoma and some of the complications that might arise. Like for example, for diabetes as well, like you can have developed diabetic retinopathy, which is the blood vessels being damaged due to a high blood glucose within the blood vessels. So it's very important to check the blood vessels within the retina to make sure that it's intact, as well as eye pressure test. So I believe that like what was shared earlier on, the glaucoma. So this eye pressure test is actually they will have a light gust of light blow of dust, air. Air that will be blown to the eye to actually see how is the reflex. This is to actually check for the pressure. Yeah, and also like what I mentioned, to check the back of the eye to ensure everything is intact. Okay, so some of the important tips which I'd like to reiterate to everyone. So the most important thing is managing the chronic diseases. Like for example, if you are diagnosed with diabetes, to ensure that your blood glucose level is being tightly controlled, make sure check your blood sugar regularly, go back to your polyclinic doctors for regular 3-monthly checkup, be compliant to your medications, yeah, because this reduces the risk of developing retinopathy. Yeah. So the other thing is to regularly follow up with eye doctors, right? Besides following up with other doctors from other specialties is also very important to ensure that your regular eye checkup is followed upon at least once a year to actually check for your eyesight. So during this eye examination, they will actually put some dilation. Yeah, they'll put some eye drops to actually dilate your pupils to actually to be able to view how is your blood vessels through the ophthalmoscope, as well as what I mentioned earlier, to maintain a record of your blood pressure. So I would advise residents, I mean everyone, to actually monitor your blood pressure and ensure that you keep a good record of your blood pressure. And whenever you go back to polyclinics or when you go back to see a doctor, you can actually show to your doctor, hey, this is my blood pressure. Is, you know, every morning I've been taking these medications and this is my blood pressure that is well controlled. And one of the things that we will reiterate is to do not smoke, because smoking itself, it increases the risk of the risk factors of all the complications that arise. Yeah. Okay, so maybe you all will have some certain questions like, you know, oh, so then when do we really see a doctor? What are some of the times that, you know, it's urgent to go to the hospital? Yeah. So I guess many of you all will have these burning questions. Okay, so this is like some of the red flag symptoms. Some of the, you know, it's highlighted in this red box over here that you can see. So for example, you have some blurring of vision, right? Suddenly when you wake up in the morning, you feel that there's a sudden blurring of vision that does not go away, right? The vision feels like you're seeing through a dirty window, like the window, you know, clear window you see through is very clear, right? You can see people, you can see the surrounding very clear, right? If the dirty window, you should know there's some patches. Okay, this suddenly appear after, like, you know, after a while, it doesn't go away. Okay, this is one of the signs and symptoms that you might want to get the doctors to see. Or maybe, like, you know, you head down to take a bus, then you see the bus number, you cannot see the bus number clearly, or something like, you know, the newspaper, if you read the newspaper, then you realize that the vision seems to be a little bit blurry, the word seems to be not so clear. So probably these might be some of the issues that might be related to your eyesight that might need to be further examined. And besides that, you see double visions. So like this is something new that you see, like, oh, I see, like, you know, there's two images of a person, or, you know, like maybe you'll see like the door, like there's two doors. Okay, and if these develop into painful eyes, okay, to see a doctor immediately as well. And when you examine, make sure that when you see your eyes, is it red? Is there any discharges coming out from your eyes? Is there any yellowish discharges coming out from your eye? Then you feel any pressure behind, like, you know, some sort of, like, you feel is somehow like pressing against your eyeball seems to be a bit more pressure in a way that you feel like, you know, there is some issues, to go back and see a doctor. And abnormal symptoms such as you can see sometimes flashing lights, sometimes some spots and some rings, or some dots, you know, some black dots around, or headache does not go away. So if you examine, if you have any of these symptoms, to immediately go back to see a doctor and and they will refer you to the ophthalmologist to actually take a look at your eyes. Yeah. And last but not least, if you cannot see the side of your vision completely, to go and see the doctors immediately. Yeah. Right. So other tips that I will share with everyone is ensuring that your home is safe. So how do we ensure the home is safe? Okay, so if there's some eyesight issues, we will recommend that the house to be kept clutter-free. So be careful of all the carpets, especially the boxes on the floor, to keep a good allowance or passageway for you to walk. Okay, if you have any obstructions or anything, you may trip and fall because of the vision. Like what I mentioned, the vision perception, the depth perception may be a little bit affected if the vision is affected. Yeah, so ensure that the floor is dry and also at the same time clutter-free, and ensure that there is adequate lighting. That's the most important thing. So at night, like let's say you're heading to the toilet and going somewhere, make sure that there is a night light that's on, or keep the toilet light on in a way to actually help you move better in the dark. Like sit and slowly stand up in a way to get yourself ready. Yeah. So besides that, if you have some issues with managing your medications in a way, then you can use a marker, or maybe when you receive your medications, you can let the pharmacist at the polyclinic or at the pharmacist there to actually help you write in a bigger label, or try to write a bigger letter for you to see clearly. Yeah. Or besides that, you also can use a magnifying glass. So in the supermarket nowadays, yeah, there are some supermarket with the magnifying glass as well to actually check for the price, and yeah, to help to see the things better. Yeah, so a magnifying glass can actually help in this way. So for some of our friends and residents, like if you all have difficulty reading the labels, having a lot of medications to manage, then you'll be actually better to get your family members to actually help you with the medications packing. Maybe can pack them in a pill box. Then it will be easier for you to actually take your medications and take it correctly. Yeah. So okay. So besides this, other tips and tricks will be to avoid heavy weightlifting and also high impact exercise. So it's like, for example, if you have underwent a cataract surgery, normally they will tell you, okay, do not lift the heavy objects, do not do high impact exercise. Is because they worry that, if you lift too heavy objects, the pressure of the eye will increase, and the pressure of the eye increase, then it will lead to the detachment. The lens will fall out in a way. So it's best that if you are not sure of what are the exercise to do, please ask the doctor to have a clarification on what are some of the exercise that you can do. And most importantly, to ensure proper care and regular checkup with your ophthalmologist, as well as to control the chronic conditions well. Yeah. So now I'll pass over the time to my colleague Xingyi, who will share with you all a little bit on myth busters. Yeah.
Hi, can you all hear me? Can Okay. Yeah. So thank you, Vincent, for sharing such an insight, information, and tips. So now I'll go on with the facts and myth. So okay. So our statement 1, right, is eating carrot will improve your vision. Okay. So maybe one of y'all can unmute yourself to share your thoughts on this. Is it a fact or myth? Or if let's say you're not comfortable, you can also put your answer input inside the chat box. As for I saw there's like a Depo High SAC. If let's say your seniors would like to answer, you also can enter into the chat box. Yeah. Okay, let's give it a while. If let's say anybody thinks that it's a myth or fact, can you all put it in the chat box, or any of you would like to answer it and share your thoughts on how do you think is a myth or is it a fact? Okay, I see. Yes, people would say yes, it's a fact. Okay. Okay, let's give another 1 or 2 seconds. If not, I will share the answer. Okay, so most of you, I see in the chat box that say that it's a fact, but actually, right, vitamin A is essential for body and maintain healthy eyesight. But however, it will not improve your vision. Yeah. So carrot is also not one of the high vitamin A vegetable. We can also have many other sources like dark lifting vegetables and bright color vegetables, dairy product, and also our fish. Okay, so it would not help you to improve, but also maintain a good eyesight. Okay. Okay, next I will go to statement 2. Okay, so statement 2 is about looking directly at the sun can improve your health and also a well-being. So what do you think? Is a myth or is it a fact? Okay, let's give about 30 seconds for y'all to share it in the chat box, or y'all can actually shout out the answer and share your thoughts on it.
It's a myth, definitely.
Okay, may I know who is that?
Cecilia here.
Hi, Cecilia. Thank you for answering. Maybe you want to share why is it a myth?
Because sun has this UV, I mean, the UV lights, they will actually damage our cornea more
All right,
than
all right.
it help. I mean, you can look indirectly the sun, maybe through a good sunglass, I mean, a very special, I mean, a proper sunglasses, maybe in the early morning hours, but not definitely whole day through.
Yeah, thank you, Cecilia, for sharing that. Okay, she's right. Okay, probably I just share the answer because I saw in the chat group a lot of you say it's a myth. Yes, it is a myth. Staring at the sun for an even short period of time, right, without wearing any eye protection can damage your retina permanently and even cause blindness. Okay, so even those like normal over-counter ordinary sunglasses and homemade filter are also not safe because they don't have a proper special purpose solar filter. So we do not just stare directly at the sun, and it will not improve your health and well-being, but it will damage your retina permanently and cause blindness lah. Yeah. Okay, so the next statement. Okay, statement 3. Losing vision is an inevitable part of aging. What do you think? Is it a myth or is it a fact? Okay, let's see, give about 30 seconds for all of you to answer in the group chat. As I mentioned, like for Depot Senior Activity Center, if let's say your senior would like to answer, probably the facilitator can help to facilitate in the chat box. Yeah. Okay, a lot of you say it's a myth. Okay, very good. It is a myth because many of the vision problems develop as we age, right, can be treated. For example, as we mentioned in series 1, there's presbyopia, which is loss of elastication of the lens and cause near vision loss. That one, it can be corrected when you wear like lenses. Okay, and for cataract, it can also be rectified by doing some surgery lah. Okay, so it is very, very important to go for eye checkup on a yearly basis. I see on the chat group, Cecilia shared that it's good to do the eye check, and I see your frustration about like getting the appointment at the SNEC, but I believe that they will try their best to slot you into the earliest slot. Yeah, but it's still very important to go for the eye checkup. Yeah. So to catch it by going for the early checkup, right, it can also catch both reversible and permanent threat to our vision, such as glaucoma, which is not reversible. So early treatment can slow or prevent permanent loss. Yeah. Okay, let's wait. Go. Okay. To the next statement. Statement 4. Okay, so all the eye doctors are the same. So what do you think? Is it a myth or is it a fact? Okay, yes, most of you got it right. It's a myth because not all are the same. Like our neighborhood, what we always go to get our glasses done, that one is called optician. It's a professional who prepares and measures and adapt the fit of our eyeglasses or contact lenses. Prescription written by ophthalmologist or any optometrist. So optician is not an eye doctor. So yeah, and also we have another tool which is quite similar, ophthalmologist and also optometrist. Okay, so ophthalmologist, that one is a doctor. Okay, so they undergo medical school, so they are licensed to practice both medicine and surgery. Okay, but the optometrist, right, they only licensed to do eye checkup, vision checkup, and prescribe corrective lenses, detect certain eye abnormalities, and prescribe medicine for only some of the diseases lah. Yeah. So next. Okay, reading in dim light is harmful to the eyes. So what do you think? Is it a myth or is it a fact?
It's a fact.
Yes, I'm sorry. Who is that?
Irene here.
Irene, am I
Yeah.
right? Sorry.
Yeah.
Okay, thank you for sharing. So can you share on your thoughts? Why do you think it's a fact?
Well, it's harmful to the eyes because it's very dim, the lights. You're going to strain the eyes.
Correct. Okay, so I see the chat box as well. A lot of you share on the fact. Thank you for all the answers. Okay, so it is a fact that reading in dim light can make your eyes is harmful for the eyes because it make your eyes tired. You need extra muscle to go and strain. Yeah. So we do not harm your eyes reading in a dim light. So try to find a good lighting and make it easier when you read and keep your eyes less tired, more straining of the eyes lah. Yeah. Okay. So we will have our last statement. Okay. You can't drive after age of 60. Is it a truth or is it a fact or is it a myth?
It's a myth.
This is my myth.
Who is this?
Two persons, Lawrence and I don't know who.
Cecilia.
Hi, Lawrence and Priscilla. Thank you for your answer. Probably, I would like to invite Priscilla first to share why do you think it's a myth?
I believe it's Cecilia.
Oh, sorry, Cecilia.
Yes.
Oh, I'm so sorry. Yeah.
Why didn't let the other person say? Because I already shared my opinion earlier. Let her have a share first, maybe. If she's up to.
Yeah. Would you like to share?
Okay. Actually, I mean, you can't. I mean, as long as I'm not sure. I thought it's only an age of 75. Then when you have to sit for, I think 70, then you sit for exam. But before that, 60, I don't think you have any issue about driving if you are above 60. I mean, age of 60. Unless I'm not sure about the medical examination part. But I was told that only 70, you have to have a medical examination. Or is it 65? The part I'm not very sure. But definitely you can still drive as long as you have full mental capacity. I mean, faculties are all working well. Because they're still working.
Right. Yeah. Thank you for sharing. So, okay, after 60, right? They say that if you are 60 and above, driving a car may be increasing difficult because age-related vision changes and eye diseases may negatively affect your driving ability even before you are aware of the symptoms. But some of the age-related vision can change commonly, like not able to see the road sign, difficulty seeing object up close, difficulty charging. So if let's say you have this kind of difficulty, you can go and see ophthalmologist to check your eyes. And what just now you have shared is good because they will go for this driving course for senior. Okay. Like what they call the AARP, American Association of Retired Person. Okay, this can help you to learn and how to compensate for the physical changes that may affect your driving ability. Yeah. So also what we always emphasize to go for the annual eye checkup to ensure that your eyeglass, your contact lens prescription is up to date, and also can ensure early detections and treatments for any developing eye health problem. Yeah, to ensure that all of you drive safely for to take care of ourselves and also to the other pedestrians. Yeah. I think this is the last statement that we have. Thank you for your time. Okay, so we will proceed to a Q&A session. So y'all can feel free to ask in the group chat or unmute yourself. Thank you so much for your attention today.
Hi, may I ask you? These days I joined quite many Zoom meetings and I have eye pain. Is it shouldn't do that? Thank you.
I think you are muted.
Oh, sorry. Yeah, so I understand your concern. Like you join all the Zooms and stare a long time at the screen. Okay, that cause your eyes to be tired, is it?
Uh, but I don't look at the screen for a long time. I just
Okay.
want to listen unless they have something appear on the screen. But just at least last Saturday, I find my left eye quite painful till next morning. Then it's okay. Is it too strange for my eyes? Thank you.
Okay, so if you are worried that you are staring a long time on the screen that cause your eyes to be tired, so you can actually look at the screen maximum 30 minutes. Then after that, you look away. Okay, you can stare at the greens outside your house or look away from any of the screen for at least 15 minutes to resume back. Yeah, sometimes will help with your eyes to have ample rest, so you will not overdo your eyes or strain your muscle. And also, just now we did mention, if let's say dim light can also cause strain to your eyes, so ensure your environment has good lighting. Yeah, so Miss Christina, is it Christina?
Yes.
Yeah,
Thank
I
you.
hope I answer your question.
Yes. I try to.
Hello, I have a question to ask. Hello? Hello, can you hear me?
Yes, we can hear you.
Yeah, I have a cataract up for a month ago, more than a month on the 11th, more than about 4 weeks, 5 weeks, 6 weeks already. So can I do exercise or not?
Okay, so for the exercise, right, I would advise that you need to seek the doctor or your ophthalmologist, which is your eye doctor, to actually see what sort of exercise is suitable for you. Like I mentioned earlier on during the sharing, that high impact exercise and lifting heavy weights, all this exercise should be avoided, is because like what I mentioned, the lens itself is attached.
Yeah,
Attached itself. So if there's any increase in the eye pressure itself, it can lead to a potential dislodgement of the lens itself.
Yes, I understand. But I missed the first lesson, this is the second lesson, right? So what about washing hair, the water or the soap going to your eyes? Is it okay?
I beg your pardon,
When
sorry.
you wash your hair, wash your hair, the water go or the soap going to your eye, is it okay?
It's okay. It's still perfectly fine for that. If you're just washing, just be mindful. If any soap goes into your eye, just remember to rinse off.
I'll rinse it off, okay.
Yes, the soap.
But if I have a slight itchy eyes on that or up on the, can I use a normal eye drop to drop it on it?
Yes, normal eye drops, like for example, if they have any lubricating eye drops, like for example, any eye drops, any lubricating eye drops will do. Can have a few drops to actually keep your eye moist. Blink, sometimes you can blink for a while, close your eyes for a while, then let the tears be able to lubricate your eyes.
Oh, so currently I still cannot carry heavy thing now.
Currently, as of now, I think you'll be better not to carry heavy things, because if you carry too heavy things, it might lead to an increase of pressure within the eye itself. So the thing is, you'll be better to actually to seek the advice of your ophthalmologist to actually see what are some of the ways, to actually help.
She told me that can do exercise up to 1 month, but some of my friends advise me better don't do it first.
Maybe you try not to do the light. You try to do the light exercises.
Okay, yes.
But not the heavy. That
brisk
involves
walk,
a lot of.
Brisk walk can.
Brisk walk, yes, definitely. Brisk walk is good. Yes.
Okay, thank you so much for the.
Yes, Cheryl raised the hand. I'm so sorry. I missed your message. I saw your questions earlier. Cheryl, do you like to?
That's my question. Can you please answer?
You're asking about the different groups, right? You like to go through the titles and the respective skills of each eye doctors. Okay, so basically the eye doctors.
Just now was not clear and was very fast.
Okay, then. All right. So the ophthalmologists, they are known as the eye doctor. All right.
Okay.
So you go to the ophthalmologist. So whenever you receive any referrals, you go over to SNEC, right? They are the ophthalmologists. They are the eye doctors who are able to see any eye conditions, diagnose any eye conditions, they are able to correct your eye conditions by giving you medications, and you are following up with them. They are called the ophthalmologists. So they are the doctors. They have a special name.
Ophthalmologist. Okay.
Yes, ophthalmologists. So so there's the optometrists as well as the opticians. So the optometrists as well as the opticians, they are different group. Okay, they don't prescribe medication. They don't prescribe eye drops or anything. They are the ones who actually are stationed, like like your eyewear shop. They are the ones who do corrective, like like degree correction. They can do basic like examination of your eyes. Like for example, is there any is there any issues with the eye? Is there any astigmatism? Is there any nearing of far visions in a way? So these are the ones they will be able to give you advice in this aspect. Hope these
Only
answers.
3 or was there more?
I'm sorry?
Only 3 groups.
Yes, 3 groups. There's only 3 groups that was mentioned. So the ophthalmologists, the optometrists, as well as the opticians.
Okay. All right.
Yep.
Thank
Hope
you.
the answers. Yeah.
Excuse me if I missed the front part. I saw it's recorded, right? Is it
Yeah.
recorded?
Okay, so if you all have missed the previous series of, let's say, today talk, you can also review back to our past health talk via our Facebook Silver Click.
Oh, okay.
They do have the playback because this is a recorded talk, so you can still review. Let's say we go too fast or miss one of our series.
Sorry, just go to Facebook and put download
Silver Click. Yeah, Silver
Oh.
Click.
So would that be Mandarin talk next Monday?
Next Monday is a public holiday, so it will be the following Monday.
No lesson.
Yes.
No talk.
Okay, let me address to Cecilia about her concern about a drop of eye drop. Let's say she administer and then she feel that the medicine flow out and all this. So it's okay if let's say it flow out, because it will flow out because it's too much. Okay, so if let's say the next time you want to put eye drop, right, you might not need to squeeze too hard. Yeah, because you also can't, is it a pea size? Because you have to drop it directly to your eyes. You cannot drop out then put inside the eyes, because it will cause more contamination. And it might, if let's say you have undergo any surgery, it will cause contamination and infection. It's okay to have too much, because if it's too much, it will flow out. It's perfectly all right. Just worry about insufficient of the medication for the next use. But you will not worry if, let's say, you drop too much, then you will be overdosed. It will not be.
So a wastage.
Huh?
Waste.
Yes, it's a wastage. So normally you just pinch low, like pinch lightly. No need to pinch until so hard that a lot of liquid came out. Maybe first of 2 times you might experience that, then you will gauge.
The best way is down for you. Just the right portion.
Oh, because it's very difficult to
Yeah, I know.
tell you.
We do ourselves. Just sure it's a weightage you do yourself, because you cannot.
Yeah, I understand.
Accurately.
Yes, especially if it's a full medication, it tends to have like you can't gauge, and then a lot of medication come out. Then, yeah, but you will not have to worry about the overdosing.
Okay.
Yeah. I hope I answer your question.
Hi, may I ask you, besides lifting heavy things, what will cause the eye pressure to increase, please?
Eye pressure increase.
Okay, so the eye pressure, right, when we exert force, right, when we lift up heavy things, we are using a lot of our abdominal strength, yeah, using a lot of our stomach muscles to actually lift up. Yeah, so when there's a lot of force that is from our core, from our abdominal side, then it brings up, okay, it brings upwards. The pressure will be upwards. And when it travels to the head, it travels more upwards, then it will actually push the pressure forward. So that increases the pressure. That's why when it pushes to the front, it increases the eye pressure.
Yeah, thank you, Radhima CC admin. They already pin down the link of the Facebook on the silver click. If let's say you have missed any of the series or just now our explanation has been too fast, you can go to the Facebook link and go back and review our slides. And as for me, you were asking about short-sightedness to see optometry or optician. So for my suggestion, because optician is more reachable for you because it's in the neighborhood, you can go there to have your eye examination. But if let's say optician thinks that you should escalate up your condition, then you will escalate up to see a doctor, the eye doctor instead.
May I ask?
Sure. Hi, Cheryl.
Okay, hi. As a person ages, short-sightedness will decrease. Then long-sightedness will increase. Is this true or a myth?
In a way, there will be a lot of, because of the aging process, like what mentioned earlier on in the presentation, aging, as our body ages, our eyesight also, ages as well. So the eye itself is a very important organ in our body as well. So as time goes by, the natural, the eye itself with going through so much changes, you will affect the refraction, the light entering. So you will have you can be either long-sighted or short-sighted. So there is a lot of changes. Yes, you're right.
I just asked, what is you said regarding the eye pressure, what does it look like when you notice you have eye pressure in your eyes?
Okay, so eye pressure, normally we wouldn't be able to tell whether the eye pressure is high or low, because it's like what has been mentioned in the series 1 of the eye care that mentioned about glaucoma. So glaucoma is actually a silent thief of sight. So in this aspect, in terms of the eye pressure, whether it's high or low, you will only be able to know if we go for a check by the optometrist. I mean the ophthalmologist, to actually do a check to see whether there's any issues with the eye pressure.
But do you have any symptom for that?
Normally the symptoms some of the key symptoms may or may not, they will exhibit certain sign of headache, some sort of giddiness, because it is central, the eye is actually quite near to the brain itself. So actually there's a lot of, because the eye also in a way help us to see and be able to make, the depth judgment and all the things. So if there's any affecting of it, it might lead to some having a bit of headaches. Yeah. So these are some of the symptoms, but may not be specific in a way. Hope that answers.
Oh yes, thanks.
Hey, Cheryl, you have questions?
Okay. That means what about this part about I forgot the English name, 散光.
Oh, 散光.
Yes.
Astigmatism.
Yes. Usually, how does that set in?
Okay, so astigmatism, it depends greatly a lot on the eye itself. Okay, our eye structure itself is a rounded structure in a way, right? It's a spherical shape in a way. So whatever the case it is, when the light enters through the eye, all right, there will be a lot of refraction that is going on. The light goes into the lens, then after it beams to our back to be able to actually see the image. So is there any alterations if the thing is not smooth in a way, in terms of the eye, our eyes is not perfectly smooth in a way, there will be a certain in a way that is not smooth, so it will actually lead to some refraction of light. So sometimes the light enter in, it may cause the distortion, and this distortion actually can lead to astigmatism, which is actually the light, that's why you see the number, sometimes you see, how come the number like a bit off. Yeah, so these are certain signs, but it will be good that you can get the optometrist to actually have a look, because they are able to see whether is there any increase in astigmatism or any issues. Yeah, hope that answers.
Yes, thank you. One last question.
Sure.
Yeah.
That I have a last question. The thing about short-sightedness, so people wear glasses. is it a myth to say that
Sorry, Cheryl. Sorry, you're muted.
short-sightedness can be reversed? So there's no need to wear eyeglasses anymore.
Okay, I'm trying to understand you mentioning short-sightedness, whether can it be reversed?
Is that a myth? Is that a myth?
Is there a need? I'm sorry?
Okay. Is this a myth?
Oh, is this a myth?
Short-sightedness can be reversed.
It depends actually. If okay, the thing about short-sightedness or the issues of, you know, some issues, it depends on whether is it correctable or not in the first place. Okay, if let's say they will have to, if based on the issues of the eye itself, like, you know, after seeing the ophthalmologist, if the issues is minimal, they can do Lasiks. Okay, they can do the procedure called Lasik, and this Lasik can actually help to ensure, you know, it's a laser procedure that can help to correct the short-sightedness. You know, like pilot, you know, some they fly the plane, the pilot must have perfect eyesight, right? So sometimes they ask, hey, how come the person is, you know, wearing the glasses and still can be pilot? So they have a certain degree that is correctable in a way that, you know, the short-sightedness can be corrected. But however, it depends on case-to-case scenario in a way. If let's say, if, you know, it depends on the eye structure. If the eye structure is totally not correctable, then they will definitely have to fall back to either glasses. Yes, I hope that answers.
Okay, thank you.
Yeah.
Hi, I see there's another one question by me. You were asking if suffering from insomnia, will it affect the eye pressure? Okay, so I'm gonna answer to that. Okay, so lack of sleep, right? Sometimes can also contribute to increase in eye pressure. It's because of your eyes does not have any enough time to rehydrate and recover. So with that, right, it was lead to the straining of the eyes, but it will only affect to cause complication to like let's say glaucoma and all this. But in normal eyes, it will not make much of the difference lah. Yeah, only if let's say like you have a history of glaucoma, yeah, it will trigger it. But normal, it will not cause much of the eye pressure to that. Yeah.
Sorry, you mean with glaucoma, if that day you happen to have a bad sleep, next day you go and see the eye doctor, your pressure will go up at
if let's say the
person has glaucoma.
If let's say you have glaucoma, it will trigger.
So it will go up at that moment.
It will be a permanent one. Yeah. So it will try to have an ample sleep. Yeah. It will affect your triggers your glaucoma.
Okay.
Hi. Is it okay to ask question again?
Excuse me, I have one
Hi,
question.
wait, sorry, Felicia here. I see that there's a lot of questions. Maybe we give some chance for the some who have not managed to seek some question. Would that be okay? Because I know a lot of keeping questions that everyone would like to take this time to clarify with our nurses as well. Maybe we can, well, Krishna will hold on to your question first, but maybe we can get Hayat or Florence to share first. Would that be okay?
Okay.
Okay, thank you.
Hannah, thank you.
Thanks, Florence here. I just known of a case that this person had her cataract done many years ago. Then recently, the check showed that the lens you know, because you have the implant, the lens implanted, dislocated. This can happen, is it?
Yes, it can happen, because even if because the implant itself is an artificial implant itself, so it's actually they remove the original lens and they put in the artificial lens, and this lens itself, like what I mentioned, is a procedure that is done by the ophthalmologist. All right, so that's why any lifting of heavy things, any heavy exercise that involves a lot of strength is greatly discouraged, is because you will increase the risk of dislodgement even after many years.
Oh, is it? I
Yes,
see. So
correct,
still
like
not carry
straining.
heavy stuff lah. Even after after the the period that set by doctor, certain period that you cannot. So after that, I still must still take care. It means once you have cataract, don't carry heavy stuff.
Yes, in a way, yes, we will greatly advise that.
Thanks. I see. Okay. Because I was told, sorry, I just continue the same question. Somebody said maybe initial stage, this person had not taken good care of the eye after the cataract, the initial stage. So that's why the lens is not so-called, how do I say, not properly set. So it will cause this problem, is it?
The lens are normally properly set already in the first place, but the thing is itself is because of the lens itself is being held by sutures, by they suture it or they laser it onto the eye itself. But however, it's still prone to dislodgement. Like maybe for example, let's say you paste something on the wall, maybe you also can use some force and you can also easily tear out as well. So, and this type of thing happens over a period of time. Like for example, maybe sometimes constipation, sometimes maybe they strain, like what I mentioned, the pressure increase when the abdominal pressure increase, it also can result in an increase in eye pressure as well, which can lead to dislodgement.
Oh, okay, thank you.
Yeah, hope that answers. Yeah.
Hi, Mr. Hayat, I understand that you have a question.
Can I speak up? Can I ask a question now?
Yes.
Yes, sure.
Okay, sorry. My question is, how many types of surgery that will the National Eye Center do for cataract? And then the other one is, can we after when the cataract is been removed, must a lens be implanted, or can we go without implanting the lens?
I'm sorry, Mr. Yap, I'm hearing from you, you're mentioning first of all, what are the different types of surgery for cataract?
Yes.
Am I right to say that?
Yeah.
Okay, and the other question is...
the other one is whether the cataract is been removed, do we necessary to put in the lens? Can we go without putting in the lens?
I'm sorry, I can't hear you from for the second question. I'm so sorry. Will you be able to speak closer to the mic, please?
Okay. Can you hear me now?
Still a little bit muffled. Yeah.
Okay. Can we remove, after when we remove the cataract, do we really need to put in the lens?
To maintain the, sorry?
When you remove the cataract.
Okay, after remove the cataract, whether to put in the lens.
Whether do we have the option not to put in?
Oh, okay. So if they were, okay, so maybe I answer your first question first. Okay. So for your cataract surgery, normally they will only, there's only one form of cataract surgery. So they have to, physically, they have to remove that affected lens, right? They have to remove the affected lens and take out the cloudiness, right? Because over time, there's a cloudy protein layer that is formed on your lens. Yeah, so they have to remove that cloudy area from your lens, to remove that part and to implant with the lens to help you see. Okay, so that is only that is the standard procedure. There is no other form of different procedures that I can think of as of now, that because SNEC provides the service in terms of they have a general cataract surgery. Yeah. And the second question that you were mentioning is whether can you go without the lens. The thing is, if the lens is removed, the lens actually is to help the light to come in, to help your retina to be able to stay focused, to be able to see the thing. So if let's say you have no lens, then your vision will be blurred in a way, because you need a piece of lens to help you be able to see things sharper. Yeah, I hope that answers, Mr. Yap.
Okay, when I ask surgery, meaning that whether you use laser or use robotic or whatever, I don't know, because nowadays got so many types of surgery. So I'm wondering what type of surgery that we're using here.
Okay, so there are different types of surgery. I guess that you will be best at the ophthalmologist when you see the eye center, when you see your eye doctor, they will be able to describe with you what are the certain ways that they can do it. I mean, there are different ways they can do it, of course, as well. I mean, I won't be the best. We won't be the best person to actually advise you on what are some of the surgeries that they are able to do, like in terms of whether is it by hand or by robots or by laser. So I guess the best person to be able to advise you will be the ophthalmologist.
But the thing is that they already given me, I mean, a proof that I will go for, but my date is not given. I never had the chance to speak to them because we were so busy. When the doctor is trying to talk to me, the nurse is pushing me to sign the form. They're just trying to push me out of the room. So difficult to ask them. So now I'm out already. Now I got so many questions on. I don't know how, whether I should make an appointment with them.
Okay, Mr. Yap, maybe I can follow up with you again after this session, so we can find out a little bit more on your conditions, and maybe I can be able to give you the advice that you need for your eye.
Yeah, okay, thanks.
Can? Yeah, hope that answers.
Yeah, okay.
Yeah.
Sorry, on top of that, Mr. Yap, probably you can actually, for those who are actually keen on our community nursing program also, you can actually call our hotline. You know how hello, yeah. So in case you can't reach us, or you would like to go to our community nursing nurse post to seek some assistance as well, you can call this hotline that was shared during our last session. Will be 9771-8842.
Sorry, the number again, sorry.
9771 8842.
8842.
So this includes we have for those who have joined us for quite a while, we have 35 community nurse posts in the southeast region. So if you would like to seek help, we got to seek some of our community nurses help, and you are able to enroll in our program, you can actually call this hotline, then we can able to help assist you accordingly as well.
When can I call? When is the best time to call?
You can just call this hotline after this session, and I will attend to you.
Okay.
Then I will pass the question over to our staff nurse Vincent, who will be able to contact you shortly.
Just to confirm, 977-18842, right?
Yeah, that's right.
Okay, thank you.
No problem. Okay, moving on. Due to the time constraint, can we hold on another 2 to 3 more questions? We get Christina first, then we will answer May's question after that. Will that be okay?
Thank you very much. Yes, this is Christina. My turn, right?
Hi, Christina.
I have cataract surgery in 2019 and also 2020, but I still need to wear glasses for reading. But before the surgery, the doctor told me that it seems like I can choose not to write for a different surgery. And the next question is that, do I need to go for checkup for my my eyes? I maybe need to change my my glasses. Thank you very much.
Okay, hi Christina. Thank you for your question. Yeah, so very interesting question. I mean that you have went through the cataract, both for your both eyes, I guess, and
Yes.
you're still wearing glasses. So it will be good. Actually, you highlighted a very important point that to actually follow up with regularly with your ophthalmologist or your opticians to actually get your eyes checked, because the glasses itself will be able to still be able to correct the degree. If there's an increasing degree, or if there's any issues with your eye, so you'll still be good to have a regular follow-up with them as well. When your ophthalmologist, on the other hand, will be able to assess how is the condition of the lens, whether is it still good, whether there's any issues with your lens. So a regular follow-up will definitely be recommended, highly recommended.
Thank you very much for your answer. Thank you. God bless you.
Thank you. Yeah. So maybe we'd like to answer May's question. Yeah, so May actually highlighted an interesting question on if the lens become moldy after a period of time after the cataract. Yeah, so can we go back and clean the lens? So unfortunately, there is no way that we can clean the lens, okay, because the lens is actually implanted. Yeah, it's an implant of the lens. So if there's any issues, like for example, if there's any cloudiness, you observe any cloudiness, okay, because this is anyway, the thing is after the surgery itself, they will still, you know, the cloudiness can still come back. Okay, there will be always the certainty of this happening. But however, if the cloudiness comes back and is affecting your vision, okay, it will be best to follow up with SNEC, with the ophthalmologist, to actually see if there's a need to change the lens. There's no way that we can clean the lens. Yeah, hope that answers me.
Thank you so much. Yes.
No worries. Okay. This.
I think we will hold one last question by Cecilia. She said that she thought that once done the cataract out, we should have almost perfect eyesight, right? So I believe that after a cataract operation, most of the patients should have a perfect eyesight, correct? I mean,
in a way, it would be a clear vision in a way. Yeah, that's correct in a way. So you won't be able to see, because in cataract, I guess most of us, you know, as we age, because of the, you know, exposure to elements, UV, then it will lead to the cloudiness. So when we remove the cataract and we put in a new lens, definitely we will be able to see clearly. Yeah, we will be able to see clearly. But however, the thing is, the perfect eyesight is definitely not the case, because like what I mentioned earlier, the shape of the lens, the shape of the eye itself, there might be some imperfection, which actually affects how light enters into the eye. So this actually results us in needing to wear glasses. The glasses is the one that actually corrects the vision.
Okay. For that also, I think it's a continuous question, so I think it actually benefits the residents as well, because of the lens that is implant, right? So they mentioned because we cannot change the lens when it's cloudy. So what is the cause of the cloudiness?
Okay, so the cloudiness itself we can relate it to, like, you know, because of the process of exposure to UV, exposure to pollution, pollutants like smoke, a lot of this UV harmful light radiation. You know, when we go out in the sun, there will be this ultraviolet light that will be also causing this cloudiness as well. So I mean, in a way, after a cataract surgery, it can still come back, but the chances is still there. But at least the lens itself is new as compared to your original, like, you know, the original piece of lens that is that you're having now. I mean, the real one that goes through a period of time, you know, so many years, then it formed that cloudiness. So I think it will take some time before this cloudiness actually happen.
Okay, I have a question to ask. Hello, are you there?
Yes.
Okay, will this cataract last forever?
No. Actually, I mentioned earlier on, it depends on the variability. There's a lot of issues. Like, for example, there can be complications. Like, for example, the lens can drop out. Like what I think many of us actually shared a concern about the lens being dislodged. Or there can be complications, like, for example, cloudiness can reoccur again. So we cannot, I mean, we won't be able to tell, like, oh, your lens will be able to last a lifetime and all the things. But hopefully, I mean, eventualities is that we hope that the lens can keep as long as possible, but there can be other elements.
Roughly how long?
I won't be able to advise, but as long as it is, yes.
5 to 10 years. That means we must take very good care of our eyes, lah.
Yes, definitely. This is the key message.
Wear sunglasses, do not carry heavy things, right?
Precisely.
Oh, not even go swimming? Go swimming?
Swimming is fine. Swimming is okay.
But water go in the eyes, right?
But you wear your goggles. Remember to wear your goggles to prevent any irritation of the eyes. Do not rub your eyes when you have the lens on already. Do not rub your eyes. Yeah.
Okay, thank you so much.
No worries.
Hi, what can we do if there's cloudiness and how to correct our vision?
Cloudiness.
cloudiness, yes. So then how can we help our vision?
So it'll be good that you will have a follow-up. Like I think earlier on there was some sharing on when can we get a referral. So you can head by to the polyclinic doctor and get a referral to be seen by the polyclinic doctor before the optometrists can the ophthalmologists can actually have a look at you to determine whether is there any issues with regards to the cloudiness.
Well, what I mean is the cloudiness is due to, over time, the lens becomes cloudy. Is there a way to help?
It's because it's a natural wear and tear. We won't be able to. That's why the regular checkup is very important, because during the regular checkup, that is the point in time where the doctors, the ophthalmologists will be able to determine is there any issues with the lens.
No, I mean it's due to wear and tear. So is there a way? Is there a solution?
Okay. Yeah, so probably, right? So during the series 1 and series 2, we got share the tips on how you take care of your eye. Okay, so you can keep it like do eye toileting, prevent infection. The dim light, you don't read things in the dim light. Then if let's say you, like for now, you do a lot of Zoom, watch TV and digital form of entertainment, you every 30 minutes you will look away or look at the greens to have your eyes rest. Make sure your eyes have if let's say you feel dry, make sure you get the over-counter lubricant to lubricate your eyes, because dehydration of the eyes will cause straining and will damage it lah. Yeah, so these are a few tips that you can follow. Yeah.
What about eye exercise?
Sorry?
I exercise means I close my eyes, so I will look up, right, left, up, down, and round about. Will that work?
Yes. You if let's say you have prolonged staring on the screen, prolonged staring on whichever, the reading, computer, TV, you can also do eye exercise. It's a good thing. Yeah.
Oh, so good. Thank you. I do it always early in the morning.
Yeah, that's very good.
Thank you, Vincent and Xingmi, for the sharing and all of your questions. I think we actually learned a lot today, and everyone is actively participating. So thank you all. So
hello.
Hi, yes.
Hello.
Miss
Sorry, may I clarify? Just now, you mentioned about don't lifting carry heavy thing, but for exercise, brisk walking, slow jogging, dancing, these are not at all heavy exercise.
Brisk walking is fine. Do not lift heavy things. Just normal, simple exercise. You just do not strain.
Yeah,
too much, yes.
Like not go to the gym and carry heavy weight like 30 kg. That one is heavy chores. But normal daily activity like strengthening and exercises are good for all of you. Not just it will help with our eye. I mean, not help the eye, will prevent the eyes to deteriorate, like cause pressure. You can also strengthen your peripheral muscle and you'll walk better.
Okay, thank you very much for your answer. Thank you. Very benefited by the talk. Thank you all of you. I wish everyone here happy, healthy, and
That's
strong.
so sweet of you, Christina. So I think Cheryl also shared the pronunciation of the ophthalmologist. So you all just can take a look as well on how the pronunciation. Thank you for sharing as well, Cheryl. So once again, thank you, Xingyi and Vincent, for the...
Can I? Sorry. Can I have one question? Hello.
Yes, okay. Hold on. One last question.
Okay. I used to have a lot of eyes tears. What is the cause of it? I mean, every time the eyes tears a lot.
So you have often cherry eyes.
Okay, so it might be one of the
eyes.
Yeah, so it might be one of the signs and symptoms that your eye is dehydrating. So it's good to have a regular, probably 2 to 3 hours regular lubricating. It will help with that.
That means by using saline solution, the eye saline, or maybe something.
Or you can go over counter.
You
can go over the counter and ask them for lubricating eye drop.
Oh, lubricating eye drop, not
because
IMO, because I'm using IMO, but it doesn't help.
Okay,
IMO, it doesn't help.
IMO have different type. It can be eye wash, it can be like lubricating. So as long as it's stated as a lubricating eye drop, it will help. Then you use it frequently. If let's say you must use it regularly and frequently to see the effects. Yeah.
What is the cause of this regular eye tears? I mean,
Okay,
it's not like
because
crying, but it's just
yes,
tears a lot.
because our brain, right? Our brain is very smart. So they know that your eyes is dehydrating. So they produce more and more eye drop. I mean, not eye drop, tears coming from the eye. So to prevent a lot excessive eye tears coming out, you should duplicate your eyes. So it will not, your brain will not help you to compensate tears, excessive tears to address to your dehydration.
Oh, okay. Thank you very much.
Yeah.
That's a good answer. Thank you. Thank you.
No worries.
Yeah. Thank you.
May I ask one last question? Very short one. I just want to know roughly what age will a person can get cataract?
Oh, this depends, ma'am. This depends because in a way that because the exposure of pollutants, the exposure to UV is different from everyone. Yeah, so definitely like what I mentioned earlier on, by the age of 40 and above, it's good that you can, to get a regular eye checkup, get your eye to be seen in a way by the optician, and follow up if there's any issues to go directly to see an ophthalmologist. That will be helpful in this aspect.
So sorry, one more last question. It seems that this cataract all happens on the woman, directly to woman. Because I went to the NEC, for last only this month on this month on the 11th. It seems that there are mostly are women, no?
There's no I don't think there's gender specific in terms of the risk factor. So
so many also trouble.
May I ask a question? Can a lens implant be done for astigmatism?
What?
Lens implant.
Oh.
For astigmatism.
Okay.
It will not correct your astigmatism. It will not correct, yeah.
Implant, no?
Yeah, it will not.
Cannot lah.
Yeah, it will not.
Okay.
Okay, shall I ask one last question that we want to take in before we end this last question that we can take in? Anyone would like to throw your questions? Otherwise, I like what Lily mentioned, I will put a full stop to it.
Okay. Can I just take it?
Yes.
Is it fair to conclude that the implant is only to correct short-sightedness and not anything else?
Oh, yeah.
You are talking about the lens implant?
Yes. Yeah, correct.
Okay, the lens implant, for lens implant itself is very different from cataract surgery itself. The cataract surgery, there is like what I mentioned, is also a piece of lens as well to add in, because they remove the affected lens and they put in a new piece of lens to actually help light to better enter and to help you see better. So it does not necessarily correct the vision. So it's still your glasses, still your eyewear that is still important to actually help you to correct the varying degrees that the issues of the eye conditions. Yeah.
Oh, so you're saying that with the implant, a person will still need to go back to the optician or optician.
You'll still be good to follow up in a way with
eyewear for short-sightedness, long-sightedness, astigmatism.
Yes,
right?
Definitely.
Oh, I see. Okay. Thank you for the privilege for the last question. Thank you. Yeah, great team. Thank you, everybody.
We are glad to help all of you. I see Madam Juliet put a thumbs up also. Thank you so much.
Good.
And we hope that all of you have learned and enjoyed the session with us today. So like what Xing Li mentioned earlier on, that next week actually will be a long public holiday. So it will be Labor Day. So happy Labor Day in advance to all. And also we have the Hari Raya Puasa. So for those who are celebrating the Hari Raya advance Selamat Hari Raya to our Muslim and our non-Muslim friends as well. So we will see you back in the 9th of May, which will be our Mandarin version. So for those who would like to join us for the Mandarin version, we will see you at 9th of May at 2 o'clock.
Okay, very good, very good. Thank you.
Okay, that's very good. And so if you like to view our past sharing series, right? I think Radimas, Gary has already shared the Facebook link, so you can tap on it to view our past health talk series. And they also have a lot of other informative programs up at their Facebook also. Thank you, Gary, for sharing again. So he has just shared in the group chat again. Then Ms. Yap, you can give me a call later on, okay? Then we will assist you with your question. So once again, thank you all for your
Excuse me, after 9th May, is there an English talk on eye? After
no,
9th May.
Unfortunately, our eye series only have 2 series.
Oh,
then
okay.
we will be moving on to our next health talk topic already.
Okay, thank you.
Okay, no problem. So once again, thank you all and good, happy long holiday.
Have a nice day. Have a nice day.
Thank
you. Bye.
Thank you. Thank you. God bless everyone. Thank you.
Bye-bye.
Bye.
Want to wish the mothers happy Mother's Day.
Thank you. Bye-bye.
Hey, make me happy. Thank you.
Yeah, Juliet, bye-bye, Juliet.